USMLE style question. A 58-year-old man with a history of hypertension and type 2 diabetes mellitus presents to the emergency department with sudden onset weakness in both lower extremities. On examination, he has bilateral loss of motor function and vibratory and proprioception sensation is preserved. Pain and temperature sensation are diminished bilaterally below the level of the lesion. His deep tendon reflexes are initially decreased but become hyperreflexic over the next few days. Which of the following arteries is most likely affected? A. Anterior spinal artery. B. Posterior spinal artery. C. Middle cerebral artery. Basilar artery. Posterior inferior cerebellar artery. Answer and explanation. Correct answer A. Anterior spinal artery, ASA, occlusion. This patient has anterior spinal artery syndrome, which results in bilateral damage to the anterior 2/3 of the spinal cord, sparing the posterior columns. Key features include bilateral motor weakness, corticospinal tract involvement, loss of pain and temperature sensation below the lesion, spinothalamic tract involvement, preserved vibration and proprioception. Posterior columns are spared, as they are supplied by the posterior spinal arteries. Autonomic dysfunction if the lesion is high, affecting sympathetic pathways. Flaccid paralysis acute phase, spasticity and hyperreflexia later phase. Incorrect answers. B. Posterior spinal artery would cause loss of proprioception and vibration sensation, posterior column involvement, but motor function and pain temp sensation would be preserved. C. Middle cerebral artery affects the cerebral cortex, leading to contralateral upper limb face weakness and possible aphasia, dominant hemisphere, or hemineglect, non-dominant hemisphere. D. Basilar artery would cause locked-in syndrome with quadriplegia and preserved consciousness and vertical eye movements. E. Posterior inferior cerebellar artery, PICA, leads to lateral medullary syndrome, Wallenberg syndrome, with hoarseness, dysphagia, vertigo, ipsilateral facial pain, temp loss, and contralateral body pain, temp loss. Key learning point. Anterior spinal artery syndrome, bilateral motor paralysis, corticospinal tract, loss of pain and temperature sensation, spinothalamic tract. Preserved proprioception and vibration, posterior column spared. Autonomic dysfunction, if upper thoracic or cervical involvement. Would you like a question on a different spinal cord syndrome?